So I am going to go ahead and get started. Hi, I'm Dr. Melissa Balisan, and welcome to Dr. Melissa, Medicine Woman. All right. Positions. Let's see here. Here we go. Sorry about that. We'll get this slideshow going. And so, okay. So this is the next episode of Dr. Melissa, Medicine Woman. And let's see here. So what we've got here is we're going to talk about what's stress got to do with it. That's right. What does stress have to do with it? So I do have a disclaimer. This show and all its contents are for educational purposes only and not intended to diagnose, treat, cure, or prevent any disease or psychological disorder. A specific physician-patient or pharmacist-patient relationship is necessary before any medical therapies are initiated. And you must consult your physician, pharmacist, or other qualified healthcare provider with questions about your medical conditions and before starting or using a dietary supplement, herbal remedy, or exercise or nutrition plan. That is my disclaimer. Okay. And so who am I? So I have over 26 years experience in both Eastern and Western medicine with over 52,000 clinical hours. And as a pharmacist, I'm your concierge consultant pharmacist. I speak to hundreds of patients a week, thousands a month. I was just on the phone just recently with a patient, and he said, well, my physician knows all of this. And I said, well, your physician actually doesn't have that much training in medications as much as a pharmacist does. So I was able to talk to him and help him with some challenges he was having. And I am called the root cause doctor by my clients. I'm also called a de-prescriber because what I do is actually help you get off of medications. And so today we are going to talk about what really is stress, why your health is important, and what is the root cause, and what are your next steps. So a little bit more about who I am. I am more than just a pharmacist. I am a wife, an aunt, a daughter, a sister. I would say I'm a dog mama. My dog just recently passed, but I think eventually I'll probably get another one. And I love Colorado. I have been married for 20 years to my wonderful husband, and I love helping people. So when we look at statistics, we look at the World Health Organization, and they call stress the health epidemic of the 21st century, with more than 350 million people being affected. And they actually list depression as the leading cause of disability. Now that, to me, those are some staggering statistics. So what really is stress? Stress is this internal wear and tear on your body. It can make you feel sick. It can make you act stupid, can make you mean. It's what happens when our demand exceeds the capacity. And so you may have heard of the fight or flight syndrome. Well, there's also other things that can happen. You could actually freeze. You could faint. So you could stand up and fight. So adrenaline kicks in. If your child is in the street and there's a car coming, you're going to run out there and you're going to be able to whisk, hopefully, away your child. Or if something falls on your child, you're going to have the strength to be able to pick things up because adrenaline kicks in. So that's the fight. Now, some of us will flee. We will run away because that's our instinct. Others of us will just freeze in place because that's what happens. Our body just freezes. And some of us will faint. And these are reactions that can happen with stress. Now, According to the American Psychological Association and the American Institute of Stress, yes, there is an Institute of Stress. Top causes of stress in the United States: job, money, health, our relationships with our friends, with our loved ones. Poor nutrition can cause stress. Overload of the media. The media, I think, is out there just to cause us stress. There is a lot of bad things that are mentioned on there that cause us stress. And then sleep deprivation can cause us stress as well. So how does stress show up? So stress can show up in many different ways. It shows up for different ways for different people. It can show up as fatigue. It could be depression or anxiety. It could be you just don't feel right. Something's just not right. It could be a headache. You could have frequent blushing. You could sweat. You could have chest pain. You could have a panic attack. You could get a little rash that comes on. Now, when we look at things that can happen, fatigue is actually the number. It's 51% of people complain of fatigue as the way that stress shows up for them, because they've just overworked their body and their body is just tired. Stress is also I talked about nutrition. It can be with weight gain from the pandemic. We need to help our bodies be more stress resilient. And so during this time, some of us have taken anxiety and depression medications to feel better. Depression, as I said, was the leading cause of disability. Most people will go see their physician as some form of stress. 90% of the time when you see your physician, it's some form of stress that you went in for. And you often get an antidepressant or an anti-anxiety agent, or they give you something to help you sleep, because those are one of the things a lot of people complain of, not being able to sleep. We may look like we have it together, but we really don't. We're just really coping. And sometimes we use coping mechanisms such as eating, alcohol. We turn to different things for our vices, and that's not a good way to control stress. Now, stress can affect every part of the body. So when I say what has stress got to do with it, and I am your Eastern and Western medication specialist. So Dr. Melissa says stress can cause your headaches. Stress can cause your heartburn, can cause rapid breathing. And I should say, it's not just Dr. Melissa. There's studies out there that show this as well. Heart attack, high blood pressure, stroke, heart attack, stress. Fertility problems. You heard of people who are trying to conceive and they're under so much stress that they can't. And all of a sudden they are able to take themselves out of that stressful situation, and voila, they get pregnant. Erectile dysfunction can happen, as well as low sex drive for both men and women. Stress can cause you to miss a period. Stress can make your menopause or perimenopause worse. It can cause you to have tense muscles. It can cause your upset stomach. I just have that nauseous feeling. It can actually cause high blood sugar, which can lead to diabetes. We talked a little bit about high blood pressure. There's really not a part of the system of the body that's not affected by stress. Most disease states are caused by stress. Now, stress management. How do we manage our stress? How are we able to handle what comes to us? Because we have finances, we have family, we have work stress issues, we have health stress issues. And so I want to tell you a story about one of my clients. We're going to call her Lulu. And Lulu came to me and she was struggling with stress. She was taking an antidepressant agent. She's on high blood pressure medication. Her stomach wasn't right. She wasn't feeling good. And what happened is that we were able to finally to go through and find the root cause. And the root cause was the stress that was causing a lot of her issues. We were able to delve in, and I worked with Lulu in order to help her reduce some of her medications, because as a deprescriber, we want to make sure that you're not taking things that aren't necessary. We want to make sure that you're taking what's appropriate for you and not just a pill. If you can do something with your lifestyle to change it, then that's always better. And so I worked with her and we were able to change some things around in her lifestyle, work with nutrition, which helped a lot with her stomach issues. And then we were able to transition her off of her anti-anxiety, antidepressant agent. Now she still is on a high blood pressure medication, but we're working on that piece. So she's on the mend. Stress resilience, the ability to handle what comes your way. I want to make sure that you can become stress resilient because stress is going to come at us all the time. It's how we handle it and how we allow that stress to affect us. Because if we allow chronic stress to come and come and come, then it's going to continue to build up and pile up. And if we don't have a way to manage it, then we could lead to some of those horrible disease states. So we want to be able to handle it. So when we look at that, we also look at your health. We look at the physical, mental, and emotional aspects of your health because it all plays a role together. Whether you're active, how your nutrition is, how your mindset is, how you feel things emotionally, that all plays a role in your health, and that all plays a role in how your stress affects your life. 1 out of every 3 women die of heart disease. It is the #1 killer of women. And that is, to me, is horrible because 96% of the time, heart disease can be prevented by lifestyle changes. Managing our stress, looking at our nutrition, looking at our movement, and a few other things, looking at our mental and emotional pieces as well. So your health does matter. And I want to raise awareness. I want you to be able to help shift your mindset, learn to manage your stress, gain the strengths that you need to gain. And I help empower you to live a healthy life with the Eastern and Western medicine, utilizing the small pieces that might be necessary of supplements, medications, other Eastern modalities such as massage, acupuncture. We look at journaling. We look at breathing. Those are some things that we can do to help manage our stress. I want you to know that you have a voice and a choice when it comes to your health, because it is your health and it's nobody else's. It's your choice to what you do with it. When we look at your physical health, we look at the wellness of your body. We do dive in and we look at your nutrition because nutrition plays a huge role in how your body is reacting, whether you're feeding it properly, are you nourishing it with the right nutrients? How is your strength and your flexibility? Are you able to walk up and down stairs? Are you able to stand upright? Those are some things that affect your day-to-day activities, your balance. Are you able to balance on 1 foot? On 2 feet even? Some people have equilibrium issues, balance issues. And so we look at that and that affects our body, which affects our stress level. Our weight, whether we're overweight, underweight, or just right, that makes a difference. How are we sleeping? Are we sleeping 7 to 8 hours a night? Or are we not getting but 2 or 3 hours? What kind of quality of sleep are we getting? What kind of sleep hygiene do you have? These are all important pieces to managing your stress. Movement. So movement is medicine. So when we talk about movement, let me go backward, I'm sorry. When we talk about movement, we are talking about that E word, exercise. And I do like to use the M word, movement, because we want to move. We want to be able to walk around. We want to be able to go up and down the stairs. We want to be able to pick up our children or our grandchildren and have that ability to move around, because keeping yourself movement and functional movement keeps your heart healthy. So let's also talk about your mental health. This is the wellness of your mind. How are you talking to yourself? How emotionally are you? Are you able to control your emotions? We all have emotions, and it's fine to have each and every one of the emotions. But there's a time and a place for certain emotions. How are you able to handle them with your stress? Psychological changes, your social well being. Are you in an environment that's healthy for you? Are you in a toxic environment? If you're in a toxic environment, that's very, very stressful for you because you're trying to do what you want to do. And yet you're in this toxic environment. How we think, feel, and act. And those are three different things. How, we think about something, we may think one way, we may feel another, and we may act a totally different way. And then sometimes those all align. But how do we actually think about ourselves? How do we feel? And then how do we act? Do we take opportunity for self-care to take care of ourselves so that we don't get stressed as much? How do we handle stress? How do we relate to others and make those choices when we're in that stressful situation? Like you're getting ready to take a test, or you're driving and traffic is it's just very stressful. It's like bumper to bumper. And how do you react in certain situations? Then we look at the wellness piece, because I like to say it's mental wellness, because I think there's a stigma out there about mental health. But each of us has mental health, but it's mental wellness. How we think about ourselves, it impacts our stress. It impacts, do we have that brain fog, that fatigue? Inflammation is huge. When we get a headache, your head is inflamed because we often will take an anti-inflammatory agent such as ibuprofen or Aleve to relieve that pain. When you get a headache, it's inflammation. When you have inflammation in other parts of your body, you have pain. Those cause different reactions to happen. It can cause GI or gastrointestinal stomach issues. Inflammation can cause swelling. It can cause all kinds of different things. We look at your neurotransmitters and we look to see how your neurotransmitters are reacting. How are you responding? How is your brain responding, your stimuli responding to the stress? We look at your healthy or unhealthy lifestyle habits. That plays a role in how your mental well-being is. And then we look at the dysfunction of your gut. There's a lot of neurotransmitters in your gut, and if they're not in balance, that can cause problems. That can make us feel upset stomach. That can make us cause indigestion. It can make us have diarrhea or constipation. And so those affect our mental wellness. It's an all body system. Have you ever had that gut feeling where your gut actually communicates with your brain? You get that feeling, in your gut where it's like, I just don't feel right about that. You get that uneasy feeling. I used to get that all the time before I would fly somewhere. I would get like an anxious gut and anxiety. Well, what happens is that your neurotransmitters are communicating in your gut with your brain, and they actually help regulate your stress response. They help regulate your immune function, which we talked about immune function last episode. So be sure you check that out. We talked about digestive function. That plays a role in how you're able to absorb your nutrients and how you're able to eliminate things. Your weight. The microbiome, you may have heard of. It's been around for a long time. It's just in the last 10 years really kind of made the news or made the media. But we've always had our guts. We've always had the microbiome in our guts, which is we have the bacteria in there. There's good bacteria, and then sometimes there's bad bacteria that comes in there. And you have to have that balance of good and bad. And what happens if you have too much of one or of too much of the bad bacteria, it can cause things to not function correctly. It can affect the way that we think, the way that we feel. And so those are things that if your microbiome is off, we need to work on that. We need to clean that out and fix that. Sometimes we just feel out of balance. Fatigue, one of the number one things that people actually stated. It was 51% of the people surveyed with the American Institute of Stress said fatigue was the number one stressor for them. Sometimes we feel sad, hungry, bloated, confused. Those are all things that happen in our gut and affect our mind. Spiritual health. Now, this is the wellness of your soul. It can also mean your faith, your beliefs, your values, your morals, the meaning of life. This all falls within that spiritual health. And we all need to have good spiritual health in order to be stress resilient. Our spiritual mindset. How do we talk to ourselves? Do we say, you're ugly, you're fat, you could do better, you should do this? Or do we say, hi, beautiful, you look great today. It's going to be an amazing day. So how do we speak to ourselves? And self-love. Making it a priority, your physical, your mental, your spiritual health. Taking time for yourself. Now, I'm not talking about being selfish. I'm talking about taking time for you. We each need time for ourselves. If we don't fill up our cup first, we're not going to be able to give to everybody else. So fill up your cup first and yours will overflow. It's kind of like the old saying, put on your own oxygen mask first before helping others. And we say this because most of the time we want to help others. We want to help do everything else first. And we neglect that one little piece. We need that oxygen in order to move forward. So fill up your cup. Let me tell you a story about another client of mine, Elsie. Now, she was taking a couple of medications, but she was really in a stressful situation. Her husband had a chronic condition that they were struggling with. And she felt the burden of that. Even though it was his condition, she felt the burden of it because it was in her household. She was taking care of him. And yes, she needed to do that. She needed to be able to take care of him. But as I said earlier, if you don't fill up your cup first or put your oxygen mask on first, then usually bad things happen. And what happened is we were working together and she was doing great on her path to have less stress. We were working through some things. She was taking a couple of supplements to kind of help get her gut back in order. And what happened is she felt a lot of stress and she ended up falling and she ended up breaking her arm. And it was because she was still brain fogged. She had taken a little time off. And this was she'd taken a break from me. So in between sessions, and she'd canceled a couple and then found out that she had fallen and she broke her arm. And so we talked together again. She came back and we worked through some things and we talked about what happened with her. And she had started neglecting herself again. So she had been on the path where she was starting to take time every day, just 5-10 minutes to kind of reflect. And she had stopped doing that. And she was under the brain fog and the fatigue and she fell and she broke her arm. Well, we got her back on track. So her arm is healing. She's back taking care of herself. I think that was probably a way of slowing her down a little bit, saying, hey, take some time. You really have to remember to take care of yourself. And so she's back on track and doing much better. Now, when we talk about the root cause, I like to think of it as looking at a problem solver, troubleshooting, looking for a solution. And those are all things that I feel that I am. So when I look around the room here, we're going to get to that root cause. When I look around the room here, how many of you have taken a prescription medication, over-the-counter medication, supplement, vitamin, herbal? Most of us. have all taken it at least once for some reason, or we know somebody who has? Yeah, so I see a show of hands here. Because, well, we had something we thought that the medication would fix, or we had something that our physician told us to take it, right? And we obey. We thought, okay, well, the physician told us to take it, so we took it. Well, what happens is that can put a stress response on us. And sometimes we just cover up pills, cover up conditions, the root cause with taking a pill. And so each year, 4.5 billion prescriptions are filled. That's a lot of prescriptions. That's a whole lot of prescriptions. And your prescriber, your physician who prescribes that, only had about 600 hours of medical training. That's about one semester. That's a fun fact. Your pharmacists have a lot more. So when we look at the root cause, we really want to delve into the root cause. And I want to tell you a little bit about my journey, because with the root cause, that was one thing that got me delving deeper and really what made me become a concierge pharmacist, is because I had trouble breathing. And so I went to a couple of different physicians. They put me on different medications. It just didn't work. And so finally, I found the right physician that helped me get to the root cause of my problem. And we were able to eliminate those medications that weren't working anyway. I started feeling better. And I wished that I had found that physician a lot sooner. It took me about 4 years, and me being in the medical field, to find the right person to help me get to the root cause. So it's essential to have somebody that can help you get to the root cause and not just layer on medication after medication, or medication that covers up a side effect of another medication. When we look at things that you're taking supplement wise, we hear our friends and our neighbors say, hey, try this, try that. It may have worked for them, but it might not be the right thing for you. So just keep that in mind. We want to make sure what's the right thing for you to treat your root cause. Sleep. Sleep is huge. We want to make sure that we allow our body to fix itself. The body at night, when you sleep, rejuvenates itself. There's a lot of processes that happen at night. And if you don't give your body time to go through that rejuvenation process, you're going to have brain fog. You're going to have fatigue. You're not going to have the proper amount. Your nutrients aren't going to be able to be utilized appropriately. Your gut may not work appropriately. Sleep is a huge component of your self-care and keeping your stress under control. Constipation. Now, this is not a fun topic, but a lot of things can cause constipation. The way that we eat, if we're not eating the proper nutrients, so our system's not cleaning itself out. Medications. A lot of medications can cause constipation. And what happens is that sometimes we've got to do a few things to do that. So if we can get off the medication that's causing that, that's great. If we can change our nutrition to help us get the right amount of fiber in our body so that we're eliminating like we need to. Sometimes also, based upon how many children you had, could cause some constipation. And so we look at the pelvic floor, and we look at whether or not you're sitting correctly, and we look at what's called a potty stool. And a potty stool is kind of like a little step. It's for adults, not for kids. That goes up, and what happens is that you're able to, when you sit down on the toilet, it elevates and it tilts back the pelvic floor, because you put your feet up on this, and it tilts it back, and it allows the colon to release nice and easy. And so that is helpful. Now, when we talk about self-care, some things could be as easy as complimenting yourself, giving yourself a hug, giving your teddy bear a hug, giving your loved pet a hug, pausing for a moment of meditation, cozying up with a warm cup of coffee or tea, warm, soothing tea, chamomile tea. sitting and listening to good tunes, having a dance party, get up and move, or just telling somebody you love them. Those are all great self-care items, easy and quick. Balance. We look at the balance of whether or not you can balance equilibrium-wise, and we also look at the balance between your mental, physical, emotional, spiritual health. When we're in balance, when our body's in balance, we feel amazing. When our digestion is right, when our head is right, everything feels great. When we're out of balance, some things just don't feel right. You feel that brain fog, and you may not be able to pinpoint the exact cause. Some things that you can do: making sure that your nutrition is correct, your movement or exercise, taking a moment for meditation and prayer. And if you still don't feel 100%, then let's get down and look to find that root cause, because there's something else underlying. Now you have a chance to live. You're only given one life. Live your best life now. It is time to take charge of your health, because it is your health. So some things: mindful meditation. Focus on one thing without judging yourself. Relax your mind. This helps your gut function better. Studies have shown that breathing, just 2 minutes of focused breathing, can have amazing results on your cognition. It can lessen your anxiety. It can improve your depression. It can even improve chronic pain. 2 minutes of breathing. You just sit, close your eyes quietly, and you take a deep breath in and you exhale for 2 minutes. You don't think about anything else. You just breathe. It calms the mind, it quiets the soul, and it helps you feel better. Self-care is the new healthcare, I really feel. Listening to your body. Our bodies are brilliant. They tell us when they're hurting. They tell us when we need sleep. Water, another huge one. Making sure you're drinking plenty of water, because water helps to flush out the toxins. It helps to hydrate our cells. And then again, mindfulness. Being mindful of how you talk to yourself. Being mindful of what's going on in your body, in your mind, in your world. Huge. Your mental state is huge. You're not alone in the struggle. We all struggle with stress. We all struggle with stress. And so it's important for us to recognize that and know that you're not alone. How do we feel about something? Somebody asks you, how are you feeling? Are you good? Well, one person I talked to, she tells me, good's not a feeling. Well, that's kind of, think about it. Are you amazing? Do you feel anxious? Are you happy? Are you sad? Think about your feelings, because the way we feel affects everything. You've probably heard the saying, if mama ain't happy, ain't nobody happy. So if mama's not feeling happy, then that can change the mood of everybody. So ladies, feel happy, feel amazing. What price would you put on your health? As I said earlier, you only get one body, one health. It may seem costly to be healthy now, but being unhealthy comes at a much higher risk and more costly. So in recap, today we learned what is stress, why your health matters. We talked about the root cause, and what is your next step. So imagine if you could, when you feel better, are you ready to feel better? Are you ready to get to the root cause? Are you ready to eliminate unnecessary medications, supplements? Are you ready to have the health and lifestyle you deserve? Imagine yourself healthy, and happy. The time is now. I've put together for you a little stress analysis so you can see where you're at. And so I'll put this link in the chat, but it's a bit.ly link, and then it's Dr. Melissa SA. And you can go and take that stress analysis. And then there's also a little gift for you as well to help you manage your stress. So I'll take questions